story and where she got her education, and then as far as any other important information you would like for the students to know.
Sure. Okay, so I'll go ahead and just kind of all depends on what you're interested in, but we have there are pamphlets for the ADN program, which is the associate degree for nursing. Okay, and then this one here is for the RN, and then this one here is a vocational nurse. This is the LVN program. Okay. So my name is Jessica Williams, and I am a master's prepared nurse, and I'm also an instructor here at South Plains College in the ADN program. And so what I do there is I am a transition instructor for that semester. So I help the nurses go from LVN to RN, okay? And so I help them transition in that semester, and then they get to move on and they become RNs from LVNs. I also taught in the LVN program, and then I also taught in the first semester in the ADN program, okay? And so being a nurse isn't just being at the hospital. You can become a teacher as well, and we need those. We need teachers, let me tell you. So how I started when I was 18, and that didn't work out for me. And I ended up going to the military, did that, came back, and I went ahead and got my prerequisites completed, and I filled out all the applications to all the nursing programs here that was provided in South Plains and in Lubbock. And I finally got accepted to the LVN program. So I got accepted to the LVN program at Reese, and I did that for the year. And then as soon as I got out, I had a job before I even graduated. So that's how prominent South Plains College students become once they get out. You become pretty competent student and work and being out there in the clinicals and being in the hospital. They see you and they see how you work and what you do, and they want you. And so, they grabbed me, and I had already had a job before I graduated, and then I got my license, and then I worked for 4.5 years at the hospital on a med-surg floor. So a med-surg floor is everything. You see cardiac, you see respiratory issues, gastric, urinary, everything. We saw it all. And you're able to learn, and I was able to understand time management and my meds and my patients and what they're going through. And it was a great experience. But I wanted more. So I reapplied, and I came back into the ADN program. I did the LVN to RN transition. And so I did that. It was only 3 semesters long. It wasn't too bad. I was able to work at the same time. And so that worked out for me. Okay. I had friends that were in the same boat, LVN to RN. They didn't have to work, or they chose not to work, and that was fine. But I chose to work, helped us out. And so after that, I went and got my BSN from LCU, and then I continued on. That's when I started working the LVN program, and I continued when I got my master's from Grand Canyon University, and that's where I was able to move forward into the ADN program. And so, once you become a nurse, LVN, it's just like steps. You can keep on going as far as you want. Okay. And that's the thing, is that first when I became LVN, I was like, I'll be fine. I don't have to go nowhere. Right. But then I saw the potential, and I wanted more out of being a nurse. And so that's what I became to do. My mother's an LVN, and she's actually a retired LVN. So she was able to retire at the age of 57. So I thought that was a good age. I'm like, I wish I could retire at age of 57. I don't think it's in my cards. So other than that, I have a presentation here, and I'm just going to go ahead and flip through. I forgot which button it was. Is it this one?
Yeah.
Okay. Oh, I went too fast. Sorry. So again, here at South Plains College, we have 2 types of programs. You have your vocational, which is your LVN. That's where I started. Okay. So here, you'll have your vocational nursing track. It's a 1-year program, so it's straight 1 year. Okay. And actually, if you calculate all the holidays and Christmas time off and all, it's literally like 9 months, but it's 1 year. Okay. For our LVN programs, there's no prerequisites. Okay. it's a 48 semester credit hours. So at the end, you'll have 48 credit hours. And then, of course, you'll graduate with your vocational nursing certificate of proficiency. So you'll actually get a certificate of proficiency, and then you'll be NCLEX ready, okay? LVNs are also called PNs, okay? And so you're NCLEX ready, so you can take your NCLEX, right? The NCLEX is the biggest thing that we're preparing you for. And that's how you get your license to become a nurse, okay? And then, of course, you get your LVN license. Yay. Woo-hoo. Then you have your RN track, right? So I'm just going to go over the generic track. I'll go over my track I went through as far as LVN to RN here in a little bit. But you have your generic student track. It's 2 years. We do have prerequisites, and I'll go over that here in just a little bit. It is 60 semester credit hours. You'll graduate with an Associate of Applied Science degree. You'll be NCLEX RN ready, okay? So you can take those boards so you can receive your RN license, okay? And then again, like I said, nursing, sky's the limit. I mean, there's still DNP, you get your nurse prac, all the things, okay? Oops. All right. So for the associate's degree nursing program, the campus is here. It's just right across the street. Our hours vary, but we are Monday through Friday. Some on Wednesdays they may have off for clinical days. Sometimes they do, but it's usually Monday through Friday. But the hours will vary. Okay, and that's just when you get your schedule and your instructors. Of course, we want to make sure that you complete the following prior to submission. We want to make sure that you apply to South Plains College, that you're TSI compliant. Okay, this is the big one right here. We want you to make sure that you have your TEAS test completed, and your reading, English, and math need to be a minimum of a 58.7. Okay, we want that for the ADM program. And then for your sciences, we want a minimum of a 50 score. Okay, and so usually they tell you that when you're there. I remember when I did my TEAS, the lady was really good about telling me what I needed to make because I was clueless. I was like, I just want to be a nurse. You know what I mean? You just walk in there. And so we do require, we would like for you to have a minimum cumulative GPA of a 2.5 or better. Okay. And then for your prerequisites, right? Your prerequisites, which would be your English, your A&P 1 and 2, we would like for you to have a 2.8 or higher. Okay. A 2.8 or higher. And so when it comes to your non-sciences, we want to make sure that you have at least 1 C. You want to make sure you at least have 1 C or higher, because what happens is those C's bring down that GPA. So you want to really pay attention to your GPA, especially like if you want to go into the ADM program, but then say you want to go into become a nurse anesthetist, right? That's a very prominent type of school, and they want high GPAs. So you got to think about your GPA, okay? So as far as your sciences, you got to focus on the anatomy and physiology 1 and 2, okay? Because once you start in the program, it builds, right? You get in there and we start building on that A&P foundation, and we start teaching you about disease processes and all these other things and medications and things like that. So you have to make sure you have that good foundation of anatomy and physiology, okay? So that's what you need to for the associate degree program. So where does a registered nurse, where can I work as a registered nurse? In the hospital, anywhere, okay? Mainly in the emergency rooms, intensive care, labor and delivery, okay? There's a lot of places that only RNs can work, right? You can also work in clinics, home health, hospice, case management. You can become a charge nurse, okay? Here lately, our graduates, I've been seeing our graduates that graduated semester ago already becoming charge nurses, and it's a beautiful thing, right? I mean, it's scary, but it's beautiful, right? Because I'm like, ooh, you're becoming a charge nurse, so excited. You're in charge of everything, you know? And so you have a nurse supervisor. You can also become a nurse supervisor or a nurse educator like myself, okay? Or also in the hospital, they have nurse educators, okay? Because we still have, in the hospital, we still got to learn, right? We got to continuously learn all the time to make sure we give the best patient care. So that right there is some places that a registered nurse can go and how you can get to RN school. Oops, sorry. So for your LVN program, we have 3 campuses. We have Levelland, Plainview, and Reese in Lubbock. Okay. Again, school hours, Monday through Friday, they vary as well. Okay, because you'll have clinical days, classroom days, all those types of things. So the requirement here is, again, you just want to make sure you have your high school diploma, GED. You want to meet your TEAS requirements for your LVN. You want to be TSI compliant, and you want to have a 2.0 GPA. Okay, you want to have a 2.0 GPA when it comes for not registering, but being admitted to the LVN program. And so these pictures here are some LVNs. This group here is from the Levelland campus, and this group here is from the South Plains campus. And these students here have already graduated and moved on. So that's always wonderful to see. All right, so where can I work as a vocational nurse? So again, when we're vocational nurses, we do still have to have supervision from our RN, okay, our registered nurse, but we can still work in all these areas in the hospital as far as your med surg, renal floors. Some oncology floors will let you work as a LVN or areas. Pediatrics, all clinics, home health, your rural hospital, most any area, and then hospice, nursing home, and of course, usually in the nursing homes, you can become a director and be in leadership in those areas. So if you're looking for some leadership, that's where you can be as far as an LVN. Okay, and so if you go the LVN route, this is the route I took, going from LVN to RN. Okay, this was one of my classes from a couple of semesters ago. Actually, they just graduated. For this class here, for this part of the program, this is considered the Advanced Placement Associate Degree Nursing Program. So again, this is only 30 semesters, but you still fulfill the 60 semester credit hours. So at the end, you'll still get your ADN, your associate degree in sciences of nursing, and then you'll still be NCLEX ready to take your NCLEX. Okay. So with this one here, you'll start off with a transition semester with me. Okay. And what we do is we work on skills, we recap on a lot of med surg, meds, those types of things, and then we move you on and you go into your more advanced med surg, OB, PD, and then your ICU learning. Yes. So, and then boom, you graduate and you're done. So at first you're like, oh my God, this is going to take forever. No, it goes by quick. A lot of the students are like, I can't believe how fast it's going. I'm like, yep, better catch on. You better catch on. Okay. So this is also a great opportunity. Going out there, getting your LVN for that year, and then coming back for your ADN. So again, choose your path. Choose what you want to do. Meditate. Think about it. Where do you feel like you fit in? Where do you feel like your time can be utilized? If your end result is to be a nurse, there's all kinds of ways to do it. Okay. Either you go the RN route, you do the 2 years, or you do the LVN route and do it for a year and then work for a while, continue to work, and then go back to school. It's okay. But you know what? Wherever you want to go, there's a path. Okay. There's always a starting point. And here at South Plains College, our nursing instructors are really big about making you successful and giving you all the tools that you need to reach your goal. Okay. And so again, you can always start off with your generic nursing, vocational nursing, and then of course you would eventually go into your LVN to RN. Okay. So here's a little video. I don't know if it's gonna play.
I think it should.
Here, I got it. Oh, there's no sound to it.
Oh, the speakers.
That's right.
Yeah.
So we also have TNSA is our student association that we have. We go to conferences. We do a lot of stuff with the community. We do a lot of volunteer work and those types of things that you can get associated with being in the LVN or RN program. So the biggest thing is you got to be a student. So we do a lot of things out here, talking to students. We do a blood drive, those types of things. And so we also, our biggest mantra right now is one and done. So one and done is for that NCLEX. We want you to go in there and take that NCLEX and be confident, ready, and be able to take it that first time and be done with it and get your RN. We also do mission trips with the BSM. They always invite us to do clinical mission trips. So they need the nursing students to actually work that, and they do. That last time that we went, I mean, you were working with nurse practitioners that also came to South Plains College, and they pretty much run the whole clinic, the students. So it's a really good opportunity. Well, and actually we work with PT, physical therapy too. So they'll go and they'll do their part, and then we go and we do our nursing part. We also do a lot of volunteer work at the Dream Center. We have a health clinic, and also we'll do groceries for them. We'll bag groceries. We'll do whatever they need for us to do as far as helping. But our biggest thing that we do is we do their health check clinic, and we do blood pressures, we do blood sugars, those types of things. If they need prayer, students are comfortable doing that, we'll do that too. That's part of healing as well, right? And so we'll provide anything that we need for those individuals that come to see us. And believe me, you're going to learn a lot of skills, a lot of things. Doing IVs, putting in NG tubes, putting in Foleys, your medications, all the things. And so we have a lot of resources, mannequins, simulation that will help get you there before we actually take you to the hospital. So we make sure that you're nice and trained up before we get you into the hospital. And we also like to celebrate the little things, like a first IV stick. And we do stick each other, just so you know. We'll give each other injections, and we will have each other stick each other with needles. So just know that. Everybody knows compassion, and you'll know how it feels, okay, when somebody else has to, or when a patient gets a needle.
So, what are some skills, or what is something that skills or something that can help a student be successful, like what you have as far as?
So for right now, I would definitely, if you're not a fan of studying, this is something that I've seen, because I have a couple of hats that I wear, is I'm also the success specialist. So I help students become successful if they're not successful in class, okay? And so what I have found is a lot of students that come to me, they don't have a really good study habit. So they're not studying, or they don't realize how much time you actually have to put in to study for nursing school. So I do understand maybe some of the prerequisites that you're banging it out. Yes, I'm making the A's, but when it comes to nursing school, there's a lot more that we're trying to get out of you with critical thinking and critical judgment. And so it takes a little bit more as far as studying. So getting your notes down, studying, printing out your PowerPoints and making sure that you understand that information, reading your book. I have a lot of students that don't open their books. So if you have a book, open that book and reading. If you're not a strong reader, start now, okay? But you really got to learn how to put the time and effort into studying and having good study habits immediately before you start, because That's usually where I find the issue. And then I show you how to study, and then it's like, boom, you're on your way. I just helped you, right? And so that's kind of the biggest thing with your A&P. I would definitely make sure that you really learn that anatomy and physiology, because again, remember, it's a building block. And so we're not always going to cover all of A&P again. We're just going to keep on going. Hey, you remember the kidneys? Remember what they did? Okay, so now we're going to move on to put in a Foley. Why would we put in a Foley? You see what I mean? And so you got to make sure you retain everything that you've learned in A&P. Okay, so good study habits, making sure that you have A&P, all that under your wing. Keep that with you. Keep all your study material for A&P. If you're able to work and become a CNA and being exposed like that with patients, I would say try to do that too. Okay, because any training or anything outside of going and being in the nursing program will also help you. Okay, it'll definitely help you. Anything else? Yes, ma'am.
I think I saw that you need a CPR certification for the LVN program.
Yes, CPR for both. You'll need CPR for ADN and LVN.
How would you go about acquiring that?
So in Lubbock, we do CPR. There's CPR places there. Usually, if you don't have your CPR, you can let them know, and we have instructors that teach CPR. So I teach CPR here, and if they need me, I'll teach CPR to students before starting the program in wherever they need me. So we have different instructors on different places that already have CPR certification and their instructor license that they can teach.
I also have another question. What classes would you recommend taking before your TEAS exam?
Before your TEAS exam? With that, I think they give you a TEAS practice, don't they? Did they still give you that? Do you know if they still give that? They used to give us like a book. I mean, this was a long time ago for me. I'm sorry? I think so too. Yeah, because I'm fixing to sign my son up, and they gave me a link. Because I remember they just handed me a book. Now it's different. So, I mean, but I think there is. They have like a practice one, and then they have the book. See if you can find the book. But yes, and then I would find that link for sure for the TEAS.
Yeah, it's all in the test.
The testing site. It should be on there.
The study,
Yeah.
free stuff, and stuff.
Yeah. So try to do that. And if anything, try to find a friend that has taken the TEAS. And if they have those study materials, you can use that too. Yeah. Yes, ma'am.
How long does your CPR certificate last?
For 2 years. Mm-hmm. And so that's what we like to start you off doing your CPR, and then you'll have your stuff for the 2 years that you're there. Anything else?
If anybody has questions about applying, as far as applications are concerned, there's someone they can talk to over there.
Yes, all you have to do is call the office, and you'll talk to Miss Fowler, and she will give you all the information that you need. You can also go over there, and we'll be happy to give you a packet. You can also talk to the director for the LVN program. It's going to be Miss Steffi, and then for the RN program, it's going to be Dr. Strong. And I have all of that over here in the pamphlets. So yes, you're more than welcome to call anytime. We're always, sometimes they'll shoot y'all to me because somebody's not there, and I will be happy to call you. Also, their email's here as well. So if you have any questions or anything, you can email them.
I got a question too. Because I'm always hearing that there's always this talk of RN and LVN is gonna be obsolete. You have to be a sin. So you always kind of hear that talk. Is that something that they'll kind of?
So at this point, with the shortage that there is with nursing, they can't obsolete LVN. It's hard. And actually, when the hospitals went to magnet status, and magnet status was where they're like, all the RNs have to have their BSN. We can't have any LVNs. Well, now the hospitals are hurting. And now the people are like, okay, well, we'll bring in, if you have your RN, well, now let's go ahead and bring in, now we need some LVNs. Now they're opening it up to have more LVNs to help because they're short. They're short at the hospital. So it's kind of, you can take what you want, but at the end of the day, it's whatever path you feel like you need to go. Because they said that even when I started LVNs, well, they're like, well, that they're not going to have LVNs anymore. They're going to cut that out in a year. Here it's been 17 years later. And so we're still doing the same track and we're still in the same boat with shortage. And actually a lot of our older generation, more experienced nurses just retired, so yes, ma'am.
The way you explained it, it sounds like you need your LVN before you get your RN. Can you just go straight into your RN?
Yes, the generic. So you had the generic one. You can be a generic for 2 years. So you can choose your path. You can be a generic, and that's the 2-year program. Or you can go to the LVN, and that's the 1-year program to get your LVN license. And then if you choose to, you can get you can go to the LVN to RN transition program, and that's only the extra 3 semesters. So yes, the only reason why I'm probably speaking on that is because that's my path that I went to. So I'm sorry about that. But yes, you can do 2 years and just go straight into RN. Yes, ma'am.
How would you become a CNA?
I think there's actually CNA courses in Lubbock, right? Yeah, there's a CNA courses in Lubbock at the Byron Martin Center. They have a CNA instructor there. And so they will get you all wrapped up. And I think there you don't have to have any prerequisites or anything. I don't want to lie to you, but and I probably should look that up and make sure I give you that information before I tell you they're going to become a CNA. But yes, at the Byron Martin Center, they do have a CNA program. I think it's only just a couple of months.
Yeah, I think it's 2 months to continue it.
Yes.
But the thing with that is it's on top of your school, unless you take it like in the summer. Like you have to, then and you can't meet your financial aid. It's about $800.
Okay.
But yeah.
But if you can get a scholarship, and there's tons of scholarships for nursing right now, because nursing is such a huge, we need nurses. We're at a deficit for nursing right now. So, I mean, they need you. If you have the heart for it and this is where you want to go, it's there. And there's, like I said, there's a lot of things. And then I forgot to add on there's travel nursing too. So travel nursing, going to different places. I know a lot of students that are traveling all over the United States doing travel nursing. So that's another benefit too that you could utilize. Anything else?
Okay, let's say that I'm you're trying into the RN program.
Mm-hmm.
Chemistry is, if you already took chemistry and you failed chemistry, but you're going through an RN, will that hinder you in getting into the RN program?
Chemistry, no. It may hinder your GPA. So if you had an F on that, so it may hinder your GPA. So that's where you probably need to see where your GPA is at with that chemistry. So if you're taking courses, I would really be careful on taking what you're taking and making sure that you're doing well if you can, and to get that GPA up, because we look at GPA.
I have a couple of questions. So chemistry used to be on the prerequisite list when they took it off?
Yes.
You know why?
Because we teach it in our stuff. We feel like we just did our own study and we realized that, it's not really benefiting for the associate degree.
Okay.
Yeah.
So if you have it, it doesn't give you, it doesn't help you.
It'll help you with your GPA if you did well.
Okay.
With your cumulative GPA. Yeah.
Okay.
So the only prerequisites we're looking at is English 1, Anatomy and Physiology 1 and 2. Those are the main ones that we want you to complete. And with your A and P, you got to make sure you have those within 5 years.
Right.
Mm-hmm.
And then I know you said it was 3 semesters, so I guess summer there's no school.
Mm-mm.
So I guess do you see a problem like when students return to school after being off for the summer? Do you tell them to study, but then just kind of keep up or
To retain?
to retain?
I mean, we build them back up we see that and we build it back up. I mean, it just takes a little time. Because we do like boot camps
Yeah.
and for skills and stuff. I mean, and I'm not gonna lie, it comes back. And you're gonna be like, oh, okay, I remember now. It's gonna come back to you. So, but a lot of students too during the summer they'll go work in a hospital or something to keep their skills up, to keep their mind going, seeing certain patients, understanding those types of pathologies and what the nurse is doing, and so that kind of helps them too.
Okay, that made me think of something else. Somebody had recommended pathophysiology just to help with the program. Is that, do y'all recommend that?
I actually teach that.
Oh, really?
Yes. The online pathophysiology, yes. So that's usually a prerequisite for tech. But if you're more than welcome, I do hit a lot of patho, and I do teach you how to study all of it so you can see how it all works in the body all together. I mean, it's up to you if you want to take it to help understand. A lot of students take it during the summer.
Right, that's what I've been trying to do. I think it was Strawn recommended that one because I'd never heard of it until she recommended it. And I said, well, I'm gonna.
Yes.
Yeah,
It's A&P pathophysiology bio 2404.
24.
So yes, and we will have a summer course for that. But I always recommend students to take that if they can, just to help refresh, keep that patho and that A&P going in their head.
And you said will it be online or in person?
It's online.
Online. Cool. Has it 2404?
Bio.
Yeah. Okay, I was looking for it yesterday. I couldn't find it. And I thought maybe it's the other way. But I wasn't looking.
Oh, well, the summer course isn't open yet.
Oh,
Yeah.
I was looking on the catalog. Just looking at the regular catalog. But I guess I was probably, I might not have been putting it in there correctly. But I'll report again.
Okay.
Because I was trying to find what I was going to do this summer.
Uh-huh.
And I was like, I can't find it. But yeah, that's good to know. Is there any difference if you go in the spring or the fall? I mean, it's just a matter of.
No, because we carry out the same curriculum each time in the fall and spring. It's just when you want to graduate.
Right.
Yeah. So you either graduate in December or you graduate in May.
Thank you very much. Any other questions? Oh, if not,
When you apply, do you think it's more competitive to apply in the spring or for the fall?
Oh, that's hard. Because I think it may be more competitive in the spring because it's a shorter time and then the fall. But I don't know. I mean, you just have to keep on, just put it in there. I can't really.
it depends on the students applying.
Yeah, it depends on which class that you're in and how low your GPA is. Because we're going to take in whoever meets those requirements. So that's the big deal. If you meet those requirements and you checked all the boxes, you should be fine. But it's going to be competitive everywhere because nursing is such a big industry and we're short, and we're trying to still get people in. So, but I wouldn't let that scare you. Don't even just throw it away. Okay. Don't even go there. Okay. That if you checked all the boxes, you're in it like anybody else, regardless. Okay.
And you said shorter time. Is it shorter to get there? A shorter path if you go in the spring?
Well, because if you think about it, it's only like we decide in October for January, and see for fall we usually decide in April for August. You see what I mean? So it just kind of all depends on how fast you want to get things ready for school. But as far as the competitive part, we just see students for what you've done and what you've completed. So.
Thank you very much.
Yeah.
Yeah, I can fill out your evaluations.
Oh, there's an evaluation.
And
Wait, hold on. Let me give you